We know that this is an autoimmune disease in which there's going to be a gluten mediated response, and an autoimmune response against gluten, which has gliadin protein, and it's going to cause villus atrophy. And the genetic component, there's going to be HLA, DQ2, and DQ8 involvement. Okay, so the thing is that this is an MCQ point. They ask you that, what is the genotype involvement. So you should remember DQ2 and DQ8, HLA, DQ2 and DQ8. So what happens when there's villus atrophy? Definitely there's going to be malabsorption. So all the signs and symptoms of malabsorption are going to be there. Chronic malabsorption, what are those? So this is something, that should be on your fingertips. This is the basics of medicine, that GIT in medicine, that a patient who is malabsorbed would have a complaint of steatoria. Okay, what happens in steatoria, that the patient is going to pass abundant stools which are going to be foul smelling and difficult to flush because they have high fat content. Okay, and because the fat is not being absorbed, it's being passed into the stools, the patient is going to have a deficiency of these fat soluble vitamins, which are A, D, E, and K. And all the clinical manifestations are going to be there. Vitamin A deficiency, the patient is going to have eye problems like night blindness and all those ophthalmological problems. And vitamin D is not going to be there. In adults you are going to have osteoporosis, osteomalacia, and kids you're going to have rickets. And vitamin K is not there, you are going to have bruises. The patient is going to have bruises and gum bleeding because of clotting factor problems. So these are all the clinical manifestations associated with it. Now what else is going to be happen when there's going to be steatoria? The malabsorption, the patient is going to have weight loss. Okay, you can find wasting. If it is an older patient with chronic malabsorption, you are going to see all those signs of malnutrition, temporal wasting. And you can also have dorsal guttering. Okay, these things you're going to find these things on general physical examination. Okay, temporal wasting and dorsal guttering. Okay, so in children, the celiac disease can present as failure to thrive, short stature, and complaints. The parents would tell you that their baby is having chronic diarrhea since weaning started. Okay, since they first gave their child a piece of roti or bread, the child started having chronic diarrhea. But they don't know now that this is because of the roti. They would just say that from the time they have started weaning, that is mostly started at around after at 6 months mostly, the child started having diarrhea. Okay, they would think maybe it's an infection which is chronic and stuff like that, and abdominal distension and bloating would be there. So whenever you get a long case of failure to thrive is very common. Long case of chronic diarrhea and short stitch is very common. So always consider celiac disease as your differential. Okay, and adults are going to be fatigued, they're going to have chronic weight loss, and they are going to be they are going to be having all those signs and symptoms of anemia. What is that? Breathlessness and cognitive impairment. They would be their reaction time would be prolonged. They won't be able to think properly. Cognition will be affected, and then the heart will be it will start getting affected, angina and stuff like that. Now, what are the investigations that you are going to go for in this case? So we have the specific investigations and we have the general investigations. So let's just first discuss the specific, but in the exam and in SEQ, you're first going to write the general ones. There are only two specific investigations. The first one is a screening investigation. And what is that? Definitely serology. And when we are going for a serology, always remember that there are three antibodies, right? Anti-gliadin, anti-endomysial, and anti-transglutaminase. Never go for anti-gliadin antibodies. Always remember that for screening you can go for anti-endomysial. I'm not writing full, don't mind my writing. Endomysial, and we are going to go for anti-transglutaminase, but never go for anti-gliadin for screening. This is a point that students get confused in. They think that maybe all three are going to be used. No, anti-gliadin is not a trustworthy antibody. And always remember that before going for an antibody screening and before acting upon its results, always try to assess the total IgA levels. Why? Because the patient might be having an IgA deficiency altogether. Many kids can have IgA deficiency. This is why this is screening test. And what is the gold standard? Okay, so if they ever ask you what is the gold standard, it's a no-brainer. It's a biopsy, but you should know the detail that biopsy, which parts of the gut. So you have to take more than four, yes, more than four. This is written in Davidson, more than four samples from the second part of duodenum. Okay, from the second part of duodenum, no, with or without one sample from the duodenal bulb. This is something which should be on your fingertips. If someone asks you in your sleep what is the gold standard, you have to tell them that a biopsy with more than four samples from the second part of duodenum and one from the duodenal bulb. This is it. Now let's move on to the general investigations. Okay, a lot of spots on the paper. So the general investigations are very simple in medicine. We know that we are going to go with the basic one, a CBC, and with our complete blood picture, I'll also do a peripheral smear. What are you going to find? Whenever you're writing down the investigations in an essay question, now always write down the findings also. What are you going to find? So that, it becomes very clear that you are, having a full command over this topic. So what are you going to find in CBC? Of course, you're going to find anemia. Which anemias? It can be micro and it can be macro. Okay, both of these can be there. Okay, because of iron deficiency or B12 deficiency, both of these. And in peripheral smear are also, very likely, not very likely, but there's a high chance of finding splenic atrophy with celiac disease. So you're going to find the features of hyposplenism. And what are those features? You are going to see Howell Jolly bodies. Okay, you are going to find those, spherocytes and all those things. Okay, so these are the things you're going to see in CBC with a peripheral smear. And then after that, we are done with serology. Biochemistry, you're also going to do a biochemistry. Basically, biochemistry, includes all those biochemical findings that you're going to find. And what are those going to be? All the electrolytes or the nutrients, they are, basically decreased because the patient is having chronic malabsorption and malnutrition. So there will be a decreased level of, you don't even have to memorize, this is a general thing. Calcium, vitamin D, everything will be just decreased, and magnesium, and even the total protein and albumin. There will be hypoalbuminemia. Because of this, there can be edema. Okay, a whole body edema can be there. In your long case, always look for these things in your general physical examination. Okay, so these are all the general. Okay, and in adults, especially in females, you can also measure the bone density. This is something you have to write at the last. This is going to give a good impression that the child knows what happens to the bones. DEXA scan to look at the bone density, or x-rays if you're suspecting a fracture, because of course the females are already prone to osteoporosis, and if they have celiac disease, it's going to double up. So biochemistry is a must. Now these are the investigations. I have discussed 3 general investigations with you up till now. I discussed about hematology, about the biochemistry and the bone density. One more thing, which is a no-brainer, whenever you have any topic which is suggesting malabsorption, in which you know that there's going to be chronic diarrhea, always go for a whole workup for malabsorption. Workup. And what is that going to be? You are going to, examine the stool of the patient. Okay, and in which you are going to do a 72-hour fecal fat collection. Okay, fecal fat collection, because there's steatorrhea, so there is going to be increased fecal fat. So this is the test we do. What else do we do to see fecal fat? We do a Sudan stain. Okay, so these are the things that you must know. So how many general investigations we have discussed up till now? 4. Okay. Now, even if you have not read celiac disease, you would know how to treat it. Okay, the problem is gliadin, which is in gluten. So go for a gluten-free diet. But the question is, if the examiner asks you the next thing, you're a final year student, you should know how to define a gluten-free diet. How would you define a gluten-free diet? The amount of gluten is less than 20 parts per million. This definition is written in Pervez Akbar. Okay, less than 20 parts per million, and the daily threshold of gluten is set at less than 50 milligram per day. So this is, the definition of gluten-free diet, not gluten diet, if I, specific definition. And what is a child or the adult not supposed to eat? They're not supposed to have wheat or barley or rye, any of those things. And within a week, the patient is going to improve after restricting the diet. And the villus atrophy would improve within 3 to 12 months. It can take a longer time. And what happens to the serology, or to the antibodies? Basically, anti-gliadin levels. Anti-gliadin levels, as I said, that never use anti-gliadin levels for a screening test. Always go for only anti-endomysial and anti-transglutaminase. But anti-gliadin, they fluctuate with the diet. So they decrease when you go on a gluten-free diet, but they're going to rise on a re-challenge. Now the re-challenge can happen accidentally, or in Pakistan, parents think that, okay, not in Pakistan, many parents, they think that, okay, the child is recovering, let's go back on roti. No, it's like, you have to avoid gluten for lifetime. So, if you think that the parents are lying to you and they're feeding the child all those things, then you can just check the anti-gliadin levels, that they were low before and now they're rising. This means that a re-challenge has been done.